We're live.
Hi, welcome to our webinar tonight on ankle and foot pain. I'm Josh Vance from Vance Physical Therapy and Wellness. We're glad that you join us. I'm sure there's going to be people that come in and come out. So tonight what we're going to do is we're going to talk a little bit about ankle and foot pain. There's a lot of different causes of it. And so what our goal is to help educate you in some common causes. We also want to educate you in some things that can be done to help if you already have it, and also some things that you can do to prevent ankle and foot pain also. We're going to do a little demonstration utilizing some technology to demonstrate and show how we can help better identify some of the specific problems that we're going to see clinically using some diagnostics that our clinic uses. So hope that you interact with us. If you have questions, feel free to type them in, let us know, and we will answer them at some point. If you are not understanding something for some reason, let us know that too, so that we can make sure we clarify that as we go on. Otherwise, I know that learning more information is going to be harder because your brain's still stuck back here on this thing that you didn't understand. So I want to make sure we clean that up and you fully understand that before we move on. All right, so let's begin. All right, so there's many different common causes of ankle and foot pain. One common cause is a strain. So from a physiological point of view, a strain is simply a tear of the muscle tissue at the cellular level. There's different grades of strains, but it's a tear of the muscle tissue, all right? And that tissue then is going to take, obviously, time to heal. Strains can be graded from, generally, I believe it's 1 to 3, okay? The more severe a strain, the more severe the functional limitation. But a common strain might be in the calf muscle, for instance. Someone that's running and they kind of tweak it and they get that sharp pain for a little bit. Well, that's oftentimes a strain of the muscle. The muscle is very similar in that, well, I'll talk about sprains in a little bit of time. So there's a lot of muscles in the ankle, and we're going to talk a little bit later about different muscles specifically that are frequently problematic, but strains are a very common injury to the ankle and foot, and because the ankle and foot is actually controlled much by all the calf muscles, okay? So when you think of the ankle and foot, you've got to realize that it's going halfway up the leg, up to the knee, and even some of the muscles are going up above the knee. So there's a lot of muscles that help control the whole ankle and the foot. Okay, so here we have a sprain. A lot of people sprain their ankles. Very common thing. They roll it, they tweak it, and basically a sprain is very similar to a strain, but it's a ligament. A ligament connects from one side of the ligament to a bone to the other side to a bone, whereas the tendon in a strain is connecting the muscle to the bone. The ligament connects bone to bone. All right, so you can see the ligament right here. That one's tweaked over here. That one's still intact. This is the most common ligament, probably in the ankle, that gets injured, anterior talofibular ligament, and a very common thing. And again, it can be graded in severity. This would be a much more severe sprain because you've actually completely torn the ligament, as opposed to a mild sprain where it may swell up, get painful for a while, but the ligament's still intact. It's not fully, completely torn. However, at the cellular level, you've still created tissue injury and damage to it, but it's not the same severity as what you see right here. Arthritis. This is a great picture of arthritis. There are two different kinds of arthritis. This is actually a good picture of rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease. It attacks your body. Your body sees itself as foreign, so it causes an autoimmune response, just like it would if you're sick. If you get a virus or bacteria infection, you get an autoimmune response to help kill that. Well, in the joints, we get an autoimmune response in the joints, and they get swollen and they get painful, and over time it slowly destroys the joints and creates inflammation and pain and deformity like you see here. So that's rheumatoid arthritis. Now osteoarthritis is different. Osteoarthritis is a wear and tear of the joints, very common and in many joints throughout the body, but it's different than rheumatoid arthritis. However, functionally, they can both create a lot of problem in limited motion, pain, difficulty walking, limited range of motion, challenging time going up and down steps, especially in the front of the ankle joint. So there's lots of functional mobility and limitations that can be caused from arthritis, and ultimately, difficulty walking or playing sports, things like that.
Josh, do you want to tilt the TV this way?
Sure. Okay, another, maybe not as common as the previous ones, but another cause of ankle and foot pain is called tarsal tunnel syndrome. There's some similarity between carpal tunnel syndrome and tarsal tunnel syndrome, but it's a different location. Instead of carpal tunnel at the wrist, we now have tarsal tunnel in the ankle and foot. All right, and you can see right through here, we have the tunnel here basically coming along here. And basically what happens is you get compression of the nerve that's sitting in this area. There's many things that can cause compression on that nerve. You can have cysts, you could have inflammation, you could have structural deformity potentially. But the nerve gets compressed, it then causes pain, sometimes numbness and tingling, weakness of the muscles if it's severe enough. So tarsal tunnel syndrome is another potential cause of foot and ankle pain. Okay, Achilles tendon rupture. You're looking at the back of the ankle and foot. And the Achilles tendon is right here, okay? So this is actually showing a rupture of a different structure, but the purpose of it is that you can see that there's tearing of the tissue. Sometimes it's a complete rupture, sometimes it's partial, but you have, like, especially in the Achilles tendon, very strong, powerful tendon that helps push your foot down. These are more common in weekend warriors and middle-aged people, all right? Younger folks typically don't get them, although it can happen still. Again, it can be graded. Essentially, Achilles tendon rupture is a severe strain, okay, of the tendon, all right? But it's so severe that you may totally tear it, and you get the calf kind of rolling up in the back of your leg. Very painful, very difficult to walk. If it's severe enough, requires surgery. If it's minor, potentially could be, well, if it's a low-grade strain, then it could be potentially treated more conservatively with other methods. But it's a very, very painful condition. Causes a lot of difficulty walking, stairs, squatting, a lot of functional problems because of it. And frequently we get a lot of muscle atrophy in the calf because it's one of the big calf muscles, and so it creates a lot of functional issues when you have a rupture. But the weekend warriors, they're the people that are most at risk for it because the tissue isn't used to being used like that, and you get a sudden forceful movement and then pop, and we drop to our knees because of the tear. Hypermobility. So hypermobility is excessive mobility. You can see clearly they have way too much motion and everything. But in the ankle, just the same thing can happen. We can have too much mobility in the ankle, which then puts undue stress to the ligaments and or stretches those ligaments out. For example, a person that is repetitively, maybe they were a basketball player and they sprained their ankle and then they sprained it again and they sprained it again. They didn't completely tear it, but now they have a really loose ankle. That joint is hypermobile and we can get pain because of that hypermobility. Once you overstretch the ligaments, the only thing you have left is muscles to kind of help hold that together. And if you don't have good, strong muscles, then that can be a difficult thing to do. So hypermobility can be a significant problem, just as much as other issues. Bursitis. Bursitis is another cause, and bursitis is inflammation of the bursa. Bursa are fluid-filled sacs between the bones and the tendons, and the purpose is to decrease that friction. So as that tendon is gliding and moving, which happens with movement, and we'll show later what that actually looks like when we do a demonstration, you'll be able to see the tendon moving and gliding, but they decrease the friction on that. And when you have an inflamed bursal sac, it's swollen, painful, and problematic. So in this picture you can see here the calcaneal bursa inflamed, and even worse so in this picture. Okay, so tendinitis. Tendinitis is anything with itis is an inflammation. So this is now, instead of inflammation of the bursa with bursitis, now it's tendinitis. So we have inflammation of the tendon or multiple tendons. Okay, so there's lots of tendons in the ankle, and you can see that in this picture. On the side, these guys over here, what they do is they pull the ankle out. Here we have the toe extensors lifting it up. Okay, and your calf tending to push it down. But if you get a inflamed tendon, again, we can have pain and limited function. It may be harder to lift the muscle up or lift the motion, the ankle, the motion that tendon does. So, for instance, over here, if we get tendinitis over here, where the tendon's inserting there at the base of the metatarsal there, and pushing the ankle out may be difficult and painful because of that inflamed tendon. And or weak typically also. Okay, so here's a pretty good picture of a dislocation. You can see that is now moved over. You also have a fracture there. However, this gap should not look like this. There's way too much gap here. But a dislocation is where something's not supposed to be. And you basically, in this situation, you've torn the ligaments, a lot of damage in there. The joint is no longer in the stable place that it should be. And so you have one bone that has moved relative to another bone in a position that is not supposed to be. Lots of damage happens in that situation. And obviously, depending on the severity of the injury, it may require surgery. When you have something like this, there's going to be surgery for the fracture and also probably to stabilize all the tendons. However, the talus is the most common dislocation and usually is associated with a severe sprain to the ligaments. Obviously, it's obvious. Okay? So dislocations, significant pain. All right, bunions. Bunions are, as you can see, a bony defect of the joint. It's a structural defect from stress to the joint and or arthritic changes can also cause it. So in here you can see that first great toe bone is got quite an angle there from that bunion. And then here it's been helped corrected slightly, which then obviously changes the rest of the joints function. So bunions can be very painful and debilitating when it comes to walking, standing, and can be corrected. Next we have shin splints. This is very common, especially in runners. So if you're a runner, you may have had this before. And it's due to inflammation of the muscles on the front of the shin from overuse. So it's basically an overuse injury. All right. Generally it's in the front of the shin. It could be in other muscles also though. But generally it's in the muscles in the front of the shin as they're kind of inserting down into that bone. Very painful, something that can be very well treated conservatively, but very painful and makes it difficult to walk. Very sore. Fractures, you can see that little crack right through there, and you can see the screws holding it back together. Obviously we aren't going to treat a fracture, that's for your surgeon, podiatrist, or orthopedic surgeon to fix. However, you know, generally due to some sort of trauma, you can break a bone in your foot. There's lots of bones to fracture, but that's a significant functional impairment when that happens, and very painful. So basically a fracture is a break within the bone. Don't think of it necessarily as the bone is completely separated, but you can have a crack, which is still essentially a fracture, and that's going to have time to heal. You know, if you have a fracture, a stress fracture, sometimes they'll put it in a boot or just modify the weight-bearing surface somehow, versus something like this, where it has to be fixated using some hardware to help hold it together while that bone grows back together and heals. Gout. This is not an uncommon issue. Gout is due to an abnormal accumulation of uric acid crystals in the joint, which causes arthritis, a lot of pain. It's usually in the big toe, can affect other joints too. It's due to too much uric acid in the blood can cause the gout. Okay, those crystals are produced, and when you get an accumulation, they be set in such as what you see there. Uric acid is produced when purines in the blood are broken down. Purines are naturally found in different foods, but also in organ meat, steaks, seafood, beer, and drinks sweetened with fructose or fruit sugar. So if you're prone to gout, modifying diet is a great way to handle it. But just understanding that, especially if you have a gout flare-up, you know, avoiding some of those things is a good idea to help with that, because you got too much of the uric acid and the body's putting it there. Okay, next is Morton's neuroma. And basically what this is it's an inflamed branch of the plantar, in other words, foot, digital nerve. So it's a nerve that's going between the two digits, and it gets inflamed and painful, usually between second and third toes, oftentimes from compression, too much compression. Poor fitting shoes can cause that. It can be very painful, and we can actually visualize that using our technology that we're going to demonstrate on a patient. You won't see a neuroma on them, however, it is something that you would be able to visualize using the musculoskeletal ultrasound that we're going to do. However, Morton's neuroma is something that can be treated. All right, plantar fasciitis. So there you see the rupture. So plantar fascia is a structure at the bottom of your foot, and it helps to create this nice little arch. It helps to hold that arch. And what happens with it, again, we have the itis, so it's getting inflamed, it's getting painful. So things that can cause it are sometimes poor foot structure, overuse of the tissue, not stretching, limited motion in the ankle. Example, if you don't have enough motion in the ankle up and down for normal walking, then that load is going to be transmitted to other structures. For instance, the plantar fascia. And the plantar fascia then is going to have a lot more stress to it than it's used to, and it's not going to be able to bear that extra load and demand. And so it's going to end up getting pulled on and potentially overstretched and painful, because we have a breakdown in either the joints above it or this, as far as mobility and range of motion. All right, so do we have any questions about anything so far? If we do, we'll clarify that before we go on. All right. So, now we're going to talk about some things that we can do to help with ankle and foot pain. There are many things and strategies that we can utilize for a lot of the different conditions that you saw. For instance, tendonitis and plantar fasciitis and bursitis, they all may be appropriate for ice. Okay, so ice is one thing that we can utilize. Ice is great. It helps decrease the inflammation. It's a temporary pain analgesic. It helps with the swelling. Okay, so if you have a sprain or a tendonitis and you've got a pretty good amount of swelling in there, ice is going to help decrease that swelling, which is a good thing. It's also going to, with more swelling, what happens is the muscles aren't able to function as well as they normally would, because we get muscle inhibition. So we want to limit that. It's also going to, that swelling is going to potentially affect your motion, how much range of motion you have in a joint. So that then can affect your walking, or make it stiff going up and down stairs and walking. Okay, so ice is a great thing to utilize, usually 15 to 20 minutes, 3-4 times a day. That takes care of it. You want to make sure that when you're icing, that you put a layer between you and the ice pack. Something between your skin to protect your skin, so you don't give yourself a little bit of a burn on the skin. All right? Ice is a great thing to use, very helpful. Stretching. Okay, so here you can see several different muscles, both from the front and the back. Stretching is really, really important, and I think we probably don't utilize it enough as a general population. People think of exercise, they think of cardio or maybe strengthening, but they don't think so much about the stretching. You know, I kind of joke with my patients in that stretching usually ends in high school because we're no longer forced to do it in PE. The reality is we still need to be stretching, all right, especially if you are going to do exercise, or if your job requires a lot of maybe manual labor or something like that. You're going to be doing the work for 8 hours. You need to be physically ready for the demand that that's going to place on your body. So stretching is one way to do it. Stretching increases the elasticity, increases the blood flow, it decreases the risk of injury. All right, so stretching is a really, really big thing. So two stretches that we can do that are very common. One is for this muscle, right? Well, it's kind of cut off here, but it goes here, and then, well, you can see the tendon here. Okay, fill in the blank there with your mind, and it's called your gastrocnemius. Okay, it's kind of the runner stretch. So with that, what you want to do is you want to have your foot nice and straight. Most people tend to turn the foot out a little bit, so you want to make sure you have your foot nice and straight. Your knee has to stay straight. Your ankle needs to stay on the floor, or your heel, and then we're going to just lean the body forward until you get a pull in the back of your calf, and then you want to hold that for a good minute. Okay? And then ideally when we're stretching, we want to stretch 3 times a day. Muscles are like rubber bands. When you pull on it, they're going to want to let go. And they're going to want to shorten back up into the position they were in. So super important that as you stretch the tissue, come back later in the day. Don't do it all at once. Do it in the afternoon. Do it in the evening. Get that muscle to start stretching. Over time, and it will take some time, that tissue will slowly creep and give way, and you'll get longer muscle. You'll have better motion, especially if you're limited pulling the ankle up, which often is the case. And you know, before going to exercise anyway, you should be stretching to prevent those injuries, such as the tendon ruptures or the sprains and the strains. So stretching is a great way to help prevent that. Oh, another stretch for the soleus muscle. This is this muscle. Okay, very similar, but the difference is we're going to let our knee bend with this. And we're going to try to drive this shin bone down towards the floor, keeping our heel down to get a pull in the back of the calf too. Same thing, you're going to want to hold it for about a minute. 3 times a day is ideal. Okay? Strengthening. So there's a lot, probably just about every condition. You break something, you're going to have to strengthen it. You have tendonitis, especially if it's overused, well, gosh, that needs to be strengthened. If you have a bursitis, strengthening still helps create better stability. If you have hypermobility or too loose of the joints, strengthening is absolutely critical because you need something to help hold it together. If you sprain something, well, you're still going to have to strengthen it also because you've damaged all those structures around it. And you get muscle inhibition and eventually atrophy if you haven't done anything about it. So strengthening is one of the most important things to do, okay, especially with chronic ankle pain. Virtually all conditions, they're going to need strengthening. Soft tissue mobilization. Okay, so what is that? Some people consider that like massage. There's some similarities. A massage therapist would do it differently than a physical therapist. But what we're doing is we're increasing the tissue elasticity. We're increasing the blood flow. We're increasing the mobility of that tissue so that it moves more normal, so that it's more supple, so that it's not tight. Sometimes you might feel like your calf muscles got little knots in them or trigger points, little balls in there. So the soft tissue mobilization helps free that up and make it move the way it's supposed to. Oh, another thing, cross-friction massage. That is a great thing to utilize, especially on issues of tendonitis, because it helps stimulate blood flow, and that then helps. The more blood flow we have to a tendon, the better it's going to heal, the quicker it's going to heal. So cross-friction is another kind of soft tissue mobilization technique, a little bit different than some of the other techniques. Also in that would be effleurage massage that we utilize for swelling. So, example, you are running, you trip over the neighbor's dog, and you sprain your ankle, and now it's swollen up, okay? So effleurage massage helps to help decrease that swelling, bringing it closer to the heart so your body can reabsorb that fluid and help get rid of it. Okay, joint mobilization. So you can see right here, ankle joint, that's our talocrural joint. Think of it as a mortise sitting like this, it moves like this. So joint mobilization, the purpose of that is to make that joint move the way it should. Joints roll and glide, okay? There has to be a normal amount of rolling, but it also has to glide. It's called what we call accessory joint mobility. Every joint has some. And when it doesn't roll and glide the way it should, the joint isn't going to move the way it should. And so it's going to be stiff or hypomobile. So we do the joint mobilization to make it move more normally to help restore normal motion. So in this case of that joint, we need that ankle up and down motion so that when you're walking, you can advance the lower part of your leg forwards over your toes as you're beginning to step. All right? So joint mobilization is a very, very important component. Ultrasound. Okay, so there's 2 different kinds of ultrasound. One is diagnostic ultrasound, one is therapeutic ultrasound. They have some similarities, but there's some significant differences. Therapeutic ultrasound, we utilize that to help increase blood flow. We utilize that to help facilitate tissue healing. Okay, so the tendonitis would be a good issue, potentially bursitis, sprains, strains, any of those things where we want to help facilitate tissue, increase blood flow. Therapeutic ultrasound can be a good choice and utilized well. Now, also there is diagnostic ultrasound. The important purpose of diagnostic ultrasound is to help evaluate different structures When you're utilizing diagnostic musculoskeletal ultrasound, there's a lot of structures you can look at. You can look at the joint, you can look at tendons, you can look at ligaments, you can see potentially bursas, you can see the nerves, you can see the arteries and veins. There's a lot of structures that you can see, and that will help differentiate potentially what's going on. For instance, we're going to do a demonstration in a second, and we're going to look at several different tendons. We're going to look at the plantar fascia, we're going to look at the posterior tibialis tendon, and we're also going to look at the Achilles tendon, and then we're going to look at the tibial nerve. I mentioned the tibial nerve when it comes to tarsal tunnel syndrome. So we can actually use this tool to evaluate that. We can measure the diameter of the nerve. We can also look and see if there's swelling around that nerve or inflammation. The same thing with the tendons. You'll be able to see if there's an inflammation. Porky Pig talking. If there's an inflammatory issue going on. In the case of the tarsal tunnel, you would also be able to identify if there's a cyst causing pressure on it. So, great tool, lots of things that we can utilize it for. So, let's go ahead and I think we'll go ahead and do that now. Alright. So, give me just 1 second to do this.
Oh, sorry. Keep the host. That's purple.
Just kind of roll it out like this. That'll work. Oh. Kelsey, slide down just a little bit. There you go. Okay, and I want you to just kind of relax your ankle. Okay, now turn your ankle in for me. Just a little bit. Good. Alright. Good, and relax. Alright, so I'm going to freeze it right here. Oops. Alright, so we can see here's the bone. Okay, and here's the posterior tibialis tendon. Alright, in this situation it looks very nice. It's very similar in size. It's got a very similar texture. It kind of looks a little fibrous-y or grainy. Alright, now with pathology we can see a difference in that. You can actually measure the diameter of it, but also you will see differences in that the texture of that tendon changes, and you'll see swelling around it and fluid. Now what we're also going to do here is if you watch that here as I unfreeze that, you'll be able to kind of get a sense of, as she moves, that tendon gliding and sliding. Go ahead and ankle in, good, and out. And you can see it gliding up and down right through here. One more time. All right, very good. down just a little bit more, Kelsey. So you can relax a little bit more. Alright, so talking about neurovascular structures, right there you can see artery and vein, okay, and right next to it we have the nerve, which we're going to look at. so we can see the structure right through there. Okay, so we can utilize this in a lot of different ways. What we're going to do now is we're going to do the Achilles tendon. Okay, you'll see at the right of the screen, the bone where we have tendon attaching. Okay, so here we have our bone, and then we have our tendinous attachment down here, and we can trace that all the way up. So if there's an issue with that, again, you're very easily able to identify that and very easily able to see as we trace that tendon. And that's just one of the structures you can see right here. There's other structures, but you can see that nice fibrous texture on the upper part of the screen, right in here. And go ahead, Kelsey, again, move up and down. Whoops, less, not quite so much. Relax for a second. Small movements, there you go. So we can see gliding and sliding in that tendon, okay? Now looking at the plantar fascia. A little bit darker here. Okay. So here's the heel, bottom of the heel bone, and here's your plantar fascia. Okay, as it's going down. So again, with changes in that tissue, you can visually see it. You can even measure it. Okay. So that's the purpose of the diagnostic musculoskeletal ultrasound, in that it allows us to have a better idea of what is going on structurally. We can identify it, we can treat it, and then we can actually look at it later and objectively see, if need be, oh, hey, that's different. It looks more normal, the diameter. For instance, if it's a nerve issue and there's inflammation of the nerve also, and such as could happen in tarsal tunnel, measuring that nerve diameter, and then coming back later, and you can objectively measure the nerve again, and you can see, okay, so it's a smaller diameter, it's getting better, and symptoms are improving, so clinically things are getting better. So that's the difference between diagnostic musculoskeletal ultrasound and therapeutic ultrasound. Diet. Okay, so those foods that we talked about that are rich in purinols, beef, organ meat, steak, organ meat, seafood, beer, sweetened drinks with fructose sugar. Those are the ones that you would want to avoid. And proper footwear. I love this picture. Very stylish shoe, however, functionally not very practical. But proper footwear is very important. You know, when you're looking for a shoe, you want something that's actually got a fair amount of support in it. Especially if you have poor foot mechanics to begin with. If you're flat-footed, all the more important, because you need something that's going to help pull that arch back up into a more normal anatomical position. So a shoe with a lot of leather through the mid-arch, through the arch, is going to be able, you'll be able to tie that in such a fashion that you can actually help kind of pull it up and support it. Okay, if you have bunions, something like that, not going to feel very good. Okay, if you have an Achilles problem, you know, there's lots of issues with footwear like that. But, you know, we're in a culture where fashion is important, but function is probably even more important for your foot in the long run. I'm sure you can find something that's fashionable and for the appropriate workplace, but maybe a little bit better for your foot. Okay. Let's see, where am I? There we go. Oh, another thing, avoiding compressive stuff around the ankle. Compressive things that may cause the neuroma, that may potentially cause stress to the tarsal tunnel. You know, compression and things like that can be just as bad as other issues. Oops. Okay, so some big tips here. Number one, if you're having pain, if it's swollen, ice is a really important thing to do. 15 to 20 minutes, 3 times a day. Make sure there's a layer between you and the skin, and it's very helpful. Start stretching. If you haven't already started stretching, go ahead and start that runner stretch that we talked about. There's more than one way to stretch anything too. You can easily do this sitting with a belt pulling the ankle up. That's another alternative. Lots of ways to do it, but stretching is very important. If you like to go walking in the morning, well, you should stretch too. If you're a runner, you should stretch. If you're going to go play football with the kids or soccer or something, go stretch. Very important, prevent that injury to begin with. And there's that other stretch that we talked about, the soleus stretch. Start strengthening your calf muscles. They're one of the more important muscles. Simple two-legged heel raise, just slowly keeping the knee straight, going up onto your tippy toes, coming down nice and slow and controlled. You might start with 10 of them, rest for a minute, do another 10, rest for another minute, do a third set of 10. Over time it's going to get easy, then you maybe increase it to 12 or 15 or even 20. Pretty soon two-legged is pretty easy, then go to one-legged. Okay? You want to improve that strength. The better strength you have, the less pain, the less dysfunction, the less disability you're going to end up having too. Gradual change in running habits. So avoiding injury, be it overuse from the tendonitis sort of thing or the Achilles rupture from taking off suddenly. If you're a runner and you want to slowly change, okay, too much too quick ends up in problems and pain. So you want to make sure that you're gradually changing your habits, especially if you're trying to increase what you're doing. If you haven't done anything, you gotta start slow. You gotta give your body time to get used to it and adapt to that over time before you start to change what you're doing, or how much you're doing, how long you're doing it, or the intensity of the exercise. Heat is another great thing to utilize. Heat increases blood flow. I wouldn't use it if it's already swollen, but for instance, maybe you're super sore after running, or you have a mild strain. The heat increases blood flow, increases tissue temperature, helps more elasticity, and it feels really good. Okay, except maybe if it's super hot outside. But generally, heat is another great thing that we can also utilize. Foot protection. I kind of like that shoe because it's A, it's a tennis shoe, and B, it's got lots of mid foot support there. So wearing good footwear is really important, both for exercise and for daily function. If you think about standing, maybe you're a server at a restaurant, or you do standing meetings a lot, whatever. You know, you're either in your bed or in your shoes 24 hours a day. So having really good support in your bed, having really good shoes is really important to protect your body. Okay? Cautious with those foods that are high in the purinols that we talked about. Okay, so that you don't get that excess purinol in your blood and then your body start putting that down where you don't want it. Your liver has to detoxify that. Okay, so, you know, things that also maybe you have a problem and you want some help with it. Well, we're here. We would love to give you an opportunity just to share what's going on. We would get, you know, we love to do free consultations. We do telehealth physical therapy. So we could do a consultation online, or you could come into the clinic and we could do it here at the clinic. I do wear a mask when I'm with patients or others. So, free consultation if you're interested, and we'll take a look at the problem. We'll talk to you about it. We'll see if there's something that can be done to help you, and we'll let you know. Okay? They're available. And if you need some help deciding, well, we can help you decide if there's something particular that you need to do for your given situation. Maybe you're a basketball player, you sprain your ankles 20 times and not sure what to do to prevent it. We can help you with that. Maybe you're just having pain, or an occasional pain in running, but it's not limiting your ability to do most other things, but yet you want to be running. Well, we can help you with that. Okay? So feel free to give us a call, 592-7117. Also, you can contact us on our Facebook page, also other social media, Twitter and Instagram, Vance PT. Would love to hear from you. If you have any questions, we will certainly answer them at this point, if there are any. Also, would love to get your feedback. If this was helpful, would you let us know what in particular was helpful for you? If you have some suggestions as to something that you would be interested in learning more about, that maybe we can help you, please share that with us too. That way we can help. If you have a question, chances are somebody else has a question, and we're here to help people. So that's our mission and our purpose, to help people. So thank you. Do we have any other questions?
Not as of yet.
Okay,
I have a question.
go ahead.
So people are stubborn, as am I.
Uh-huh.
And when I have something that's bothering me with my foot or my ankle, at what point should I stop trying to take care of it myself and contact someone like you?
Okay. So the question is, sometimes this individual is stubborn and they've been trying to take care of it on their own, but it's not getting better. At what point should they try to get some help? That's a really good question, and it's a little bit difficult to answer in some ways. But if you have a problem, let's look at tissue healing. Okay, basic tissue healing from injury takes about 6 weeks. So let's run a scenario. You're walking, you step off the curb, you tweak your ankle, you fall down. A little bit of swelling, a little bit of bruising. You're able to kind of limp off, go home. Okay, continues to persist over the next 2-3 weeks. Maybe you needed a crutch for a day or two, but now you can walk on your own. There's still a little bit of a limp, but it's still problematic. 3-4 weeks goes by, a little bit of swelling still having a little bit of limp. You notice your ankle motion isn't great, and you're still having some issues. A couple more weeks go by, you're trying to help it out. Still having some pain, you're not able to go jogging or play with your kids. It's time to get some help. Okay, tissue healing, basic tissue healing takes about 6 weeks physiologically. There are things that you can do to make that take longer. There are conditions that can make it take longer. For instance, diabetes, ignoring it and continuing to re-injure it. And frequently that's what happens, not intentionally, but because when you have tissue injury, if that tissue doesn't fully have time to heal, and you do something and you basically get that pain in there, and it re-injures that structure. So you have to basically be able to get the pain to stop and allow it time to heal before going back to specific task. That takes a while. Okay, so in that situation, it varies. If you're having a problem and you've had problems for a month, 2 months, certainly longer than 2 months, yeah, it's time to get some help from somebody, because there are things that can be done that help you get better quicker if done earlier. So another example, someone that has bad foot support and they have, say, a tendonitis, and they wait and they don't do anything about it, and they just kind of have this low-level inflammation, irritation, and now that tendonitis gradually turns into tendinosis. So the difference between tendonitis and tendinosis now, instead of that tendon just being inflamed, now we've got some degeneration of the structure, okay, is now more severe, it's going to take longer to heal, and you've now got some structural changes in the tendon itself, which ultimately, if it continued on, could actually go in and tear if it got worse. So, you know, if you catch things earlier, a little bit of treatment is much better than having to have a lot of treatment, or, you know, some sort of surgery or something more significant or drastic later. So that's generally what I suggest to people. Okay, any other questions? If not, all right, so thank you again for joining us. If you have questions, feel free to send that in to us. Even after this, you can email us. Go to our website, vancept.com, and there's a link in there that you can ask questions or get in contact with us. You can also call us. Feel free to call us, and the therapist can answer that. So thank you for joining us tonight. I hope that was helpful. Give us some feedback. We'd love that. And also, this will be posted on our Facebook page and website eventually too. So thanks again, and we'll see you all later next time.